Are you also disturbed with mood swings before or during your periods? Hello, welcome to my channel. In today's video, I will tell you about the most cringe-worthy fact about premenstrual dysphoric disorder. But before we start, please subscribe to my channel and hit the notification bell. Thank you. What is premenstrual dysphoric disorder, PMDD? Premenstrual dysphoric disorder is a condition that causes changes in your mood and behavior every month after ovulation, when hormones are released from the ovaries. It is most often first noticed during the luteal phase, the second half of your menstrual cycle, and can last up to 4 months after ovulation. This affects around 1 in 10 women and is thought to be a type of premenstrual syndrome, PMS, but there may be differences between PMS and PMDD. Premenstrual dysphoric disorder, PMDD, also known as premenstrual syndrome, occurs in women. This disorder is characterized by emotional and physical symptoms that occur around the time of ovulation. The main symptom is depression, which interferes with daily activities such as getting out of bed and taking care of personal hygiene. What causes premenstrual dysphoric disorder? It's common for women to suffer from PMDD, but what are the causes? At first glance, it seems like a simple case of PMS every month. But there's more to it than that. Premenstrual dysphoric disorder, PMDD, is a recurrent disorder characterized by symptoms of depression, anxiety, and irritability usually occurring in the weeks just before menstruation. It affects 5 to 10% of women of reproductive age and can result in severe distress and impairment of quality of life. PMDD is a form of major depression like melancholic depression or bipolar affective disorder. There are many different theories about this condition, but most studies suggest that there are multiple causes for PMDD. Researchers do not know the exact causes of premenstrual dysphoric disorder. Hormonal change throughout the menstrual cycle plays an important role. The level of serotonin is changed throughout the menstrual cycle. These changes may towards premenstrual dysphoric disorder. When does PMDD happen? The answer to this question depends on a number of factors, but it can generally be placed in the months before and after menses. For example, if you have been menstruating for 3 consecutive years, when will PMDD usually occur? You should begin menstruating at age 12 or 13, so if you are now 18, then PMDD will typically start around age 24. If you menstruate once per month, then PMDD should start around age 18 to 19. At this point, every individual will have different experiences. Some women may not experience symptoms until they're closer to being in their 20s, while others might experience symptoms earlier. What are the symptoms of PMDD? PMDD is much like any other type of mood disorder. It is characterized by a change in mood, irritability, and anger. The most common symptoms are related to affective disturbances and physical symptoms, such as breast tenderness or growth, food cravings and bloating, PMS symptoms, headaches, irregular periods, and fatigue. Symptoms of PMDD include lasting irritability or anger that may affect other people, feelings of sadness or despair, or even thoughts of suicide, feelings of tension or anxiety, panic attacks, mood swings or crying often, lack of interest in daily activities and relationships, trouble thinking or focusing, tiredness or low energy, food cravings or binge eating, trouble sleeping, feeling out of control. Physical symptoms such as cramps, bloating, breast tenderness, headaches, and joint or muscle pain. What are the other treatments for PMDD? PMDD is a disorder that causes severe physical and emotional symptoms during your menstrual cycle. And what's unfortunate about this is that there are no drugs to treat it. However, that doesn't mean it's impossible to live well with PMDD. There are some treatments for PMDD that you can try at home, along with self-help tips you can do to reduce any symptoms as much as possible so you can enjoy life despite this condition. PMDD treatments include selective serotonin reuptake inhibitors or antidepressants, SSRIs. Serotonin levels in the brain are altered by SSRIs. 3 SSRIs have been approved by the Food and Drug Administration, FDA, to treat PMDD. Sertraline, fluoxetine, HCI paroxetine. Pills for birth control. To treat PMDD, the FDA approved a birth control pill containing drospirenone, droespirenone, and ethinyl estradiol, ethanyl estradiol. Physical symptoms such as cramps, joint pain, headaches, backaches, and breast tenderness may be relieved with over-the-counter pain relievers. These are some examples: ibuprofen, naproxen, aspirin. Stress management techniques such as relaxation techniques and spending time doing things you enjoy. How can I cope with PMDD? There are several treatments available for PMDD, including the use of medication or behavioral therapy. Although these treatments are effective in decreasing symptoms and improving your quality of life, most women do not respond to them well and continue to suffer from PMDD. Conclusion: if you're worried about the signs of PMS, then a good first step is to see your doctor and find out for certain if you have PMDD. If that's the case, then there are treatments available to ease your symptoms and make life easier both physically and mentally. On the other hand, not everyone who has bad PMS has PMDD, but those who do have it should be prepared to have their lives disrupted at least a little bit monthly until they can get their symptoms under control. That way, women will know to take their symptoms seriously, and men can understand why when their loved ones aren't themselves once a month.